you very much, Joe. Representative Courtney has been in the forefront of this issue for 3 Congresses. And like he said, we have to keep on fighting this because things don't come easy, but eventually, sometimes we prevail. And this situation is really a matter of Alice in Wonderland. People are in the hospital, as the Congressman said. They're oftentimes in a room with somebody who is admitted as a hospital inpatient. They too are sharing the same staff. They're getting care in the hospital, and they're there overnight, in many cases, many nights. And they're being considered outpatients. And the law says that you have to be an inpatient for 3 days. It's just language, and it demonstrates how important language is. We began to see this issue. I think my first client with the issue was over 15 years ago, but about 6 years ago, it started to really escalate. I remember when the congressman was first elected, bringing this issue to him, and I think that you kind of scratched your head. It doesn't make any sense, and it doesn't. And it's not fair. And the folks who are implementing this at the Centers for Medicare and Medicaid Services are saving money at the expense of people who actually qualify for Medicare coverage, which isn't good for the public feeling about Medicare and the way government is fair or not, because we all know that if someone's in the hospital and sleeps there for 3 days and gets care there, they're an inpatient, not an outpatient. In fact, I remember a few years ago my mom telling me that her friend was in the hospital, and she said to me, but you know, it's Friday, so she's not going to get a lot of care until Monday. And I said, well, make sure she's been admitted. And she said to me, of course she's been admitted. She's in the hospital. And I said, trust me, just make sure she's been admitted. She hadn't been. She was there through Monday and then started getting care, more care. I mean, she wouldn't languish over the weekend. So the point is that people understand that this isn't right and it doesn't make sense. And at the expense of human beings, we're saving money that the law doesn't intend to save. We're keeping people from getting skilled nursing facility Medicare coverage because you have to have those 3 inpatient stays. And I was mentioning to Matt Barrett earlier that this is also incredibly important to the state. These costs are often being shifted to the Medicaid program. We represent a lot of people at the Center for Medicare Advocacy who are eligible for Medicare and Medicaid. And the good news is they can get those hospital services paid and then the nursing home services paid under Medicaid. But it's not appropriate. Those days should be covered by Medicare. Medicaid is the payer of last resort. So I call upon the governor and the Medicaid director here in Connecticut and across the country to understand this issue as well. Legally, people who are in the hospital for 3 consecutive days receiving health care are inpatients, and if they need daily care when they get skilled care when they get to the nursing home, they should be getting Medicare coverage. The fact is, it doesn't comply with the law. We're fighting it in court. We're fighting it on behalf of individuals all the time who do and don't have Medicaid. We're working with Congressman Courtney and a really incredibly robust coalition. So I hope we'll finally get this back to where the law always intended it. And I applaud all the families who manage with all the unintended consequences that come from this very, very Machiavellian rule policy, which is not in compliance with the law, with good faith, or with common sense. Thanks so much.